All right, that minute has passed. Again, welcome for those who have joined in the past minute. We are thrilled to have you attending this Pre-Africa Climate Summit 2 webinar on health as a climate investment, African evidence for Addis. We are also very thrilled to have with us a very strong team of moderator, keynote speaker, and panelists. Those will be introduced shortly to you by our moderator, which I will introduce to you. And then I will take a step back and let the webinar be running by the moderator. I want to just speak one sentence or two sentences on this webinar and the why. If there's one thing we have noticed over the past years, is that the effects of climate change on people's well-being, especially on the African continent, is disproportionate to what is happening across the globe. However, not only in Africa, but internationally, health is not recognized enough as being part of the effects that climate change has on our world. Now, steps have been made. We've had numerous conversations, we have numerous declarations, we have had numerous events and conferences where the importance of health in the climate change processes was emphasized. And I must say we are making strides due to all the hard work of many of the people that are attending this session. However, ACS2 is another opportunity for us to consolidate on those progresses and take yet another step. This webinar is meant to do that. This webinar is meant to hear from experts across the board about how they see health within the climate change processes. And therefore, we are also aiming to come out of this webinar with a set of messages, core messages that we can take to ACS2, because many of us will be there, and use them for advocacy and taking next steps within the climate and health sector. So without further ado, I would like to introduce you to our moderator, Dr. Jeremiah Mshosho. Dr. Jeremiah Mshosho is the African Regional Team Lead at the World Health Organization. He also has a PhD in Climate and Renewable Energy Finance. In this role, he collaborates across 47 African member states to design and implement impactful strategies addressing climate change, health, and environmental challenges. He works cross-sectoral and aims to advance universal health coverage in this work. As you can hear, he's had a broad and a deep experience in working on multidisciplinary teams on all topics related to renewable energy, climate change, green innovations, biodiversity. And nowadays, his focus is on climate change, health, and environmental challenges, and therefore the perfect person to lead the conversation today. So, Dr. Jeremiah Mshosho, please, over to you for the moderation of this webinar. Thank you very much.
Thank you so much, David, for that introduction. Thank you so much, colleagues, and good afternoon, distinguished speakers, panelists, and participants. It is my pleasure to welcome you all to this pre-ACS2 webinar, which is titled Health as a Climate Investment, African Evidence for Addis. This particular conversation comes at a critical moment as we prepare for the Africa Climate Summit in Addis, and also the second African Climate Summit, which I believe is going to serve as a critical platform for us to be able to mobilize climate finance for climate action in Africa, and also to ensure that we strengthen the unified voice of Africa in international climate change negotiations, and also to catalyze investments for climate action, especially for the health sector. This is quite an opportunity for us to be able to showcase Africa's leadership through a range of climate actions and initiatives which are already undertaken across the continent, highlighting Africa's growing role in shaping global climate action solutions. For the health sector, ACS2 presents a real opportunity in ensuring that health is not on the sidelines, but at the very center of Africa's climate resilience agenda. We must ask ourselves a key question today. How will the climate and health events during this ACS2 contribute to the outcomes of the ACS2, especially focused on the intersection of climate change and health? We are going to see a number of health-related events taking place at the ACS2. The first one is an event which is organized by Amref and its partners, which is titled Unlocking Climate Finance for Health. This would be a very good event for participants to also attend. Secondly, Amref is also going to be launching the Climate Change and Health Negotiators Curriculum, which again is a powerful tool for us to be able to amplify Africa's voice during global climate negotiations. And thirdly, we are also going to see an event organized by WHO Afro, which is focusing on bridging the African climate and health frameworks towards a unified response. So these and many other events together will actually offer an opportunity and a chance to put forward clear advocacy messages, concrete evidence that then positions health as a climate smart investment. And most importantly, this conversation we are having today is really key in terms of the discussion on how we are going to feed into the key outputs and outcomes of the ACS2, such as, number one, the African leaders' Addis Ababa Declaration on accelerating climate action and finance for Africa's green future, a call to action. So this is one key output we should target. Secondly, there's going to be the mobilization of green investment commitments, including showcasing of multi-billion-dollar projects across various sectors. And lastly, and perhaps most importantly, there's going to be a clear roadmap of implementation of the summit's declaration going forward. So we believe that this is critical, and our task today is not only to share experience, but also to make sure that what emerges from this conversation strengthens our common evidence base, sharpens our advocacy messages, and builds the collective momentum we need heading to Addis. So I look forward to this rich discussion, and thank you all for lending your voices to this crucial dialogue. So before proceeding further, I would like to briefly just introduce our keynote speaker and also our panelists. So we have a single keynote speaker and we have 4 panelists today. Unfortunately, because we've got 1 hour, I will not go deep into their profiles, but rest assured that these are highly experienced and motivated colleagues who are going to be speaking today. So delivering our keynote speech is Dr. Martin Muchangi, who is the Director of Population, Health and Environment at Amref Health Africa. And Dr. Muchangi has recently been appointed as the coordinating lead author for the Health and Wellbeing chapter of the Governmental Panel on Climate Change Working Group 2 in the AR7 report, which is a good thing because health climate evidence has been lacking, and we believe that this role will take things further. On our panel, our first panelist is Dr. Sam Oti, who is the Senior Program Specialist at the International Development Research Center, IDRC. Second, we have Dr. Ama Esau, who is a Climate and Health Lead at the Africa Group of Negotiators. Welcome, ma'am. We also have our third panelist, Mr. Ephraim Shitima, who is the Director of Green Economy and Climate Change in the government of Zambia. Welcome, sir. Lastly, but not least, we are having Ms. Mulango from Malawi, who is also going to share with us some experiences from the ground. So with this high-powered delegation, we expect a lot of thought leadership, but also from the floor at the end, we also expect a lot of discussion, a lot of exchanges in terms of what key advocacy messages we can push ahead of the conference. So to kickstart the discussion, allow me to invite Dr. Mchangi to give us the keynote speech so that we can set the context, we can set the scene for the discussions today. Dr. Mchangi, you're welcome.
Thank you. Thank you so much, Dr. Jeremy. And I just want to advance what you just said, making health part of the climate smart investments. And for me to do that, I just want to share one slide, which I like sharing for the purpose of simplifying the understanding of this subject matter of climate change and health. And colleagues, just to define what climate change is, we all live in an ecosystem. And this ecosystem is composed of both physical environment, chemical environment, and biological environment. And so when we are talking about climate change, it's part of the environmental change which is happening around us. But the key thing is how did we get where we are? It began by, first of all, emitting greenhouse gases, which go to the atmosphere, and that's what is being demonstrated in the figure that I'm showing up there in excess. And that traps, heat below in the earth that we are living in. Now, the effect of that is that there is major disruption within the ecosystem that we live in. One, these floods that we are experiencing already, there are droughts that we are experiencing, and that is just the water part of it. And those of you who have actually lived experiences, you can speak to, the year 2024, having been one of the hottest years that we ever experienced, and it has also been recorded by WMO in recent terms. And what is happening to where we do our livelihoods, especially for farmers, is that they are losing farming land. We are experiencing situations where the buildings that were built to rust are now being washed away by climate change. And that is a domino effect. But when it comes to health, of course, that's where the human being is centered. And we have climate change affecting us both through communicable diseases and non-communicable diseases. Worse off, we are spending money where we are not supposed to be spending. And so when you see people dying because of climate change, you understand the entire nexus around where it began, how it is moving. But the key question is, do you want to continue this way? The answer is no. We already see that WHO is recording more cholera cases. We already see that our health systems are getting weakened as a result of all these disruptions. We cannot continue this way. And so for us to move forward, I think there are a few things that I'm going to speak about, and I'm going to speak about the policy imperatives that we are supposed to be considering moving forward. I'm going to speak about some of the best actions that we need to present at ACS2 for consideration, and how firmly we should be grounded to speak our minds and our language as a sector. So the first thing that I would want to speak to is that, number one, when you look at the policies at the national level, many governments in Africa have done their best to try and consolidate the information that can give guidance in terms of planning and investments in climate change. But that has been at a suboptimal level. And that's why I would want to say that the first call to action would be, we need to ask the stakeholders, the governments, to already conduct VNAs, vulnerability assessments, and thereafter develop the health national adaptation plans, which then would help in terms of budgeting and making sure that money is actually placed where it's supposed to be. I'm happy to report that WHO and partners like Amref are already in the process of supporting governments to consolidate that action of ensuring that we have a clear evidence map that speaks to what needs to be done, how communities are getting affected, and how much money is actually required for us to move forward. Now, the second element is that we are at a stage where we are developing NDCs, and these are commitments which governments normally make in terms of cutting down emissions, and all those commitments which governments are held accountable according to the Paris Agreement. It is an opportunity for the health sector to ensure that our messages, our targets, our imperatives are actually captured within the NDCs, and so that we can track that moving forward. I would also want to say that work has been done, and thanks to WHO and many other colleagues, the supporters like IRC, Wellcome Trust, etc., who have actually helped in terms of pushing the health message at the SBs, that's the subsidiary bodies, and other forums where decisions are made. And now we are at a stage where we are making the group on goals on adaptations. So the health targets need to be there. And we need to push the message so that we are not just getting captured in the periphery, but we are actually at the center of it. So without going so deep into that, because I know we'll have more opportunities to discuss in details about the policies and the key messages that need to get into those platforms, we have an opportunity at the ACS2, and we have an opportunity at the upcoming COP30 and many others. But the question is, how are we going to position ourselves to be fit for purpose for that? Now, I'll transition to speak about the many questions which the health sector has been asked, because in the beginning, we were being asked, what does the health sector want to bring on the table? And we were actually positioning ourselves as a sector which is very strong in adaptation. And the argument was, if then you want water for the purpose of maintaining hygiene, for example, and ensuring that we are cutting the cycle of diseases, then that's the work of the Ministry of Water. If you want to improve nutrition and you want good food for the communities, then that's the work of agriculture. So what is the space for health in all this? The space for health in all this is within climate resilient health systems and putting primary health care at the center of it. And how do we do this? Because it can also be complicated and it can also be very easy. So for the purpose of simplification, one of the most important things to have at hand is data and evidence. And evidence which is authentic to the communities, evidence which tells the story in a big way and putting the person at the center and their health at the center. And I'm happy to report that many stakeholders are working towards this. Amref is actually hosting one of the policy and research center on climate change and health. And what we want to do is to aggregate data, ensure that that data is providing evidence that can then be used across the continent for planning and at the end of this. Then the second thing that we need to do is that we need to start speaking about context-specific best buys. And what I mean is that when you look at the diagram, we are talking about indoor air pollution. So what is it that we can propose to be done by the communities to ensure that indoor air pollution is very controlled? What is it that we can do to ensure that food is produced in the easiest way, that is available, accessible in the quantities and the quality that is needed by our communities? Those are some of the best buys that we need to aggregate from an evidence perspective, from an investment perspective, and present it for consideration as cases for investment. Then the third thing that we need to continue doing is we need to continue elevating the voice of health and centralizing health within the conversations of climate change. And because as long as we remain in the periphery, When it comes to the decisions around investments, then we will still not get enough kind of funding that can drive us to where we want to be. Above all, we need to continue driving fit for purpose policies that are then going to give guidance to this sector. Now, I would want to end by saying this. We cannot continue being at the corner as the health sector. Integration is very key. We cannot continue trying to be the health sector that does its own things and expect other sectors to do their own things. I mean, all that will not come together to produce the kind of health that we want to see. We need multi-sectoral collaboration. We need interaction on data. We need to bring those who are most vulnerable at the center and ensure that the story that we are telling is actually authentic. And it is very possible for us to grow without actually growing the emissions. It's possible to grow our economies without growing the emissions, and that ties with the green energy transition, a process which we need to embrace from the health sector, a process which we can contribute to cutting down the emissions as well as adapting. So I want to end it at this point and really wish the rest of us very good interaction in this meeting. Thank you.
Thank you so much, Dr. Muchangi, for that very powerful delivery. If I forget anything, I will still remember one thing you said: we cannot continue this way. So this is, for me, it's one of the biggest statements. The data, the evidence speaks for itself, and definitely we do not want to continue this way. So thank you so much for that. And I would kindly request you, Dr. Muchangi, that in one sentence, what advocacy message should we carry forward to ACS2 to elevate health as a climate investment? I request that you put it in the chat box. Think about it, and then in one sentence. Thank you so much. So moving on, after our keynote, we are going to be now getting to speak to our very experienced panelists. And as you have heard from Dr. Muchangi, evidence is everything. We need to demonstrate what we are claiming. So to start with, I'm going to go to Dr. Sam Oti to tell us a bit more about what types of evidence have most successfully influenced the climate policy and financing decisions so far. In your opinion, if you could, do that in the next 1 minute or so, would really be grateful if you can share with our participants. Over.
Yeah, thank you. Thank you, Jeremiah. And hello, everyone. It's a privilege to be here. I don't think I can possibly do that question justice, but let me try. I think very broadly, I tend to think of the most influential evidence sources to fall into two buckets or two categories. The first is what I'll call authoritative scientific assessments. Now, for those who are not, who don't have a solid climate change background, this might be news to them, that one of the most prominent sources of authoritative science in climate, in the climate space, is what is known as assessment reports. These are reports that are commissioned by the IPCC or part of the IPCC, and they are the most authoritative synthesis of climate science and produced by thousands of scientists across the world. They are produced every 6 to 7 years, and they form the basis of a lot of the foundational decisions that have been made in the climate space. AR1, Assessment Report 1, was basically the foundation for the establishment of the UNFCCC. AR5 was the foundation for the Paris Agreement in 2015. And AR6 was quite influential in what is now known as the Loss and Damage Fund. And for many countries, their national adaptation plans tend to cite these ARs, of course, in addition to citing local data sources and analysis. Then the second sort of broad category is economic cost analyses. And these kinds of evidence generally quantify the economic impacts of climate change. And I think one of the most influential historically is the Stern Review. Some of you might have heard about it. It was published about 20 years ago. And the arguments in that review basically helped shift the debate on climate change from being purely an environmental issue to an economic imperative. For example, the Stern Review demonstrated that the cost of inaction, if we don't do anything about climate change, it will cost our GDPs global GDP between 5 to 20% loss annually. Right, that's the cost of inaction, and that cost is far greater than the cost of acting today or at that time, which would have been just 1% of global annual GDP. And since then, there have been other reputable sources of economic and financial arguments for climate action. One that stands out is the reports that come out of the International Renewable Energy Agency, or IRENA. They've published influential data and reports on the economics of renewable energy, including recently this market analysis of the state of renewable energy in Africa. And that actually paved the way for the Accelerated Partnership for Renewables in Africa, also known as APRA, which was announced by Kenya's President Ruto at the first Africa Climate Summit back in 2023. So these are not exhaustive, but I think they are illustrative of two important considerations when it comes to climate evidence. Climate change, as we all know, is heavily politicized. And so evidence for climate policy and finance needs to be rigorous, and it needs to come from the most credible sources. And the second thing is that money talks. And so economic analysis that show the cost of inaction, the cost of action, the cost-benefit analysis, these are all very critical to influencing policy and investment cases. Back to you, Jeremiah.
Dr. Oti, thank you so much. Very, 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 very powerful, those two subcategories of sort of evidence which could really influence policymakers. I hope that at some point in time we can have something around non-economic losses, because we know that this is quite a big debate, and this is quite very interesting also to see that AR7, Dr. Mchangi, will be part of the people who are going to be, looking into things when it comes to that intersection. But just if you could, tell us a bit more about what, critical gaps exist in terms of data, which may actually undermine investment decisions in climate change and health, and, maybe how could we close those gaps?
Yeah, I think Dr. Mishangi alluded to it. One of the big gaps that we have is this lack of integrated climate and health data platforms. So health data sits in its own silo. We have climate data in its own silo. And many African countries in particular are unable to bring these two data sources together to get insights on the impact of climate on health, or to even design appropriate interventions and policies. And this can be extended beyond even just environment and climate and health data to other sectors. Again, Dr. Mushangi talked about multi-sectoral action and the need to involve other sectors. So health determining sectors like agriculture, transport, energy, urban planning, data within these sectors are also sitting in silos. And we are so basically we are nowhere near having this full picture of the climate health situation across most African countries. Another is linked to my earlier point about the importance of economic analysis. That's a gap that we face on the continent. And I personally have been advocating for a dedicated research program on the economics of climate and health in Africa. Money is a language that all policymakers understand, yet we don't have strong local evidence on the economics of climate and health. So how do we address these gaps? The siloization issue, that's the issue of fragmented data sources. I think we need to establish cross-sector data collaboration platforms. And I think the kinds of successful models we need require ministries, health ministries, and other ministries in the health determining sectors to share data through common platforms that are supported by standardized protocols, and perhaps even have linked to centralized databases. And I know, for example, that Rockefeller Foundation and Wellcome Trust are supporting the World Meteorological Organization and the World Health Organization in an initiative that seeks to rapidly accelerate and scale weather and climate insights such that they can feed into health decision-making processes across low and middle income countries. Then there's also the economic analysis issue. I think we as climate health people need to engage economists, not just health economists, development economists, environmental economists. We need to be intentional, as Dr. Mushangi said, about bringing them to the table. IDRC, we adopted a similar approach when we were setting up our research program on NCDs about a decade ago. And we learned sort of the hard way. After many years of programming, we realized that if we really wanted to get the attention of policymakers, we needed to speak the language of economics, of money. And it worked. In South Africa, the health promotion levy that was passed by their parliament, I think was in 2018 or thereabouts, was a direct result of economic analysis that was produced by local researchers that we had supported. Back to you, Jeremiah.
Dr. Sem, I like it. The language of money, economics of climate change and health. I think this is very, 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 very critical. Thank you for that. And also, I would ask you to put your sentence in the chat box. One key advocacy message we should carry to SES2. Thank you so much. And moving on, you know, your points really raise very critical points about how evidence links to action. And if then evidence gaps make it hard to mobilize resources. So I would like to go to Dr. Essel, Dr. Ama Essel, because we've realized that, you know, evidence gaps make it a bit harder to raise resources. What strategies have worked in elevating Africa's climate health priorities in the international negotiations so that we could promote more climate finance towards the health sector? What sort of strategies have you seen working, Dr. Am?
Hello, thank you for this question. Climate negotiations have been interesting. As you all know, it's gone on for years. But as Martin has said, it looks like the health voice has been a little missing. And this is now the time. So I'll just give, there's nothing easy under the negotiations. Realize a few years back, we had challenges with the issue of loss and damage, and they've traveled so far. So it was agric and gender issues. But then systematically, they've all made inroads, and now they have a voice in the center of the climate discourse. And I believe the health sector, we can learn from them and see how we also place ourselves in the climate change discourse, in the international negotiations. First of all, the most important thing for me is to have Africa have a unified voice. So that to have that, you need to have a unified voice in messages that are going to the AMSEN, that's the ministerial conference of the climate or environment ministers, and we need one voice going to the CAHOCs, where we have the government or the heads of states on climate change also meeting. We need one voice in one thing we call the African Common Position. And to do that, we need a number of things, which have already been said. The evidence-based information, simplified in a way that a non-health person can understand clearly and be able to project the economics, so that when a head of state looks at these things, they are interested in having them in a common position, because they see it as a critical thing that they need to have at the end of every conference of parties or every negotiation sector. And to do that, we need to mobilize people. We've been talking about not working in silos, which is key. We need to, right from our countries, our communities, work with multiple actors, collaborate with different sectors in the country, right from a bottom-up approach from the communities, especially involving the NGOs, CSOs, youth, and even the gender people, so that we can together help them understand where we want to go. It's not only the health NGOs, but we need to collaborate with multiple actors and then have one voice to be able to incorporate in these positions. And it's important in doing that to highlight Africans' unique voice, because when we go into the negotiations, there are a lot of other actors also there. Everybody is seeking what works for them from the different regions, from the Americas to the Asian, etc., and the different negotiation groups. And in this messaging, we need to find that Africa has always said we need to prioritize adaptation and resilience as a priority. That is imperative for Africa. As we are discussing today, it's also important to be able to also elevate health to be seen as an economic venture, looking at co-benefits of different things, interventions, mitigation interventions from other sectors, and how health can be can be centralized in this is important, so that people can see that economically it is important for health to be given the space to speak one, and to given the economic support to implement things in our various countries. To be able to help Africa to speak as to get to this common position, even after we have put them maybe our arm's length messages in the African one, I forgot what we are now doing for the African Climate Summit, for example. To be able to finally get it into the center or in the negotiations, you need vehicles, you need human beings to be available to speak in the various negotiation rooms. And to do that, you need to build capacity. So for me, it's key before we go into COP, even from this very year, to build capacity of various actors. First of all, the negotiators in Africa, so the AGN negotiators. And then also, because we want to lift the economic pact, I believe that we need to bring in the climate and the finance negotiators within the AGN also to speak, to really understand where we are coming from. And then the youth and then the NGO sector are very key in doing that. So I was very happy to hear Martin saying that you've already, hello? Hello?
Yes, we can hear you.
Okay, I was very happy to hear that we've already started engaging with we have a book already to help with this training. This will be key, and I'm hoping that around between now, even during the African Climate Summit, we are going to find the opportunity to actually engage people or train different groups, if not at the summit, then on the outskirts of COP will be very important for people to be able to understand and be able to speak to the issues in the various room. I think, Jeremiah, you mentioned something about non-economic losses. I think it's already being discussed under loss and damage. It's one of the key areas they are discussing. So the health sector will also need to see how we connect with that and build on that as we try to build our voice into a space. And I think on this one, I'll stop for now and then engage further as.
Inspirational. Thank you, Dr. Esel. It's always a pleasure to be running the corridors of COP with you all the time, trying to push this subject matter. Key things, very key things. Africa, common position on climate change and health. Also making sure that there's cross-sector collaboration, capacity building, as well as, messaging, which is actually very clear now that we're going to ACS2, and that will be actually towards COP30. So that would be critical if you could post for us just a single advocacy message we should carry to ACS2 in the chat box. We would really be grateful. So we are going to build on these ideas with a real story or real stories from the field. All this, what we have said here, what does this look like in practice? And here, if, some stories from the front line can actually help us. At this point in time, I would like to go to Miss Malango Kaira. I hope I am pronouncing your name very correctly. And could you tell us your lived experiences? What concrete examples show that investing in health strengthens climate resilience? And in responding, if you could also just put a bit of some lessons from the field which can inspire both policymakers and funders in order for them to view health as a climate smart investment. Over to you, Ms. Malango.
Thank you so much. I hope you can hear me.
Yes, please go ahead.
All right. So I will not use the video because I'm using my phone. So if I allow me, I'll just use the audio. Thank you. And thank you, everyone. And just to agree with all the key speakers who have spoken, I want to start that with my experience in the field, I've observed and noticed that health alone is being treated as a stand, as not an issue that needs action. So if you agree with me, health is both a standalone issue. At the same time, it is a cross-cutting issue. It is a standalone issue because we look at the general public health, where we consider things of wash, we consider things of malaria, for example, and also how climate change impacts contribute to cholera, as it was mentioned by Dr. Nishan, and also how climate change contributes to diarrhea. So, for example, in the case of Malawi, in 2023, 2022, we were affected by Cyclone Fred, Cyclone Idai, and Cyclone Anna, and they had negative impact on people's lives, and also they had negative impact on the mental health of young people, women, and even men, and also they had negative impact on the SRHR, which is sexual protective health, where there were reduced access to health services because many communities were displaced. For example, in the southern region of Malawi, many people were displaced, and also they had also negative impact on the agricultural sector. Last year, in 2023, we were affected by the dry spells, and also there was drought in the northern region of Malawi, where people had no rain. And this contributed into communities or the nation being food insecure, and working with communities on the ground and also working with young people on the ground. There were some cases where they had to travel longer distances to fetch for food, longer distances to fetch for water, and also just to fetch for firewood. And even when it comes to SRHR, they had to travel longer distances to look for the SRHR health services where they can access them, and also just to have these health services available. And we noticed that these climate change impacts, they also contributed to increase malaria cases and also increase cholera in the community, and also increase child marriages, because we had seen how Fred affected young people. They had to stop going to school, and some were forced to be married off at a very young age. So we could see that the health issue, or the climate change and health nexus, they have both direct impact on people's lives. At the same, they have indirect impact on people's lives as well. So the indirect impact comes from when we try to intersect the agricultural sector, the energy sector, as it was mentioned, and also just looking at health in general, because they indirectly contribute to food insecurity when there's drought, and also when there's no rainfall, and when the heat waves, for example. And also directly, they contribute to maternal health, they contribute to increased cases of cholera, increased cases of diarrhea, increased cases of malaria, which is also like a health cost on its own, because we haven't really tapped health as a standalone issue. And even in the discussions, health doesn't come out clearly. That's why you try to, when you look at international level, we always try to integrate health as a cross-cutting issue, when in actual sense, it is not just a cross-cutting issue, it is also a standalone issue. So these are some of the experiences that young people are experiencing, and have also contributed to mental health issues. So, for example, in the community, social men are expected to provide. How can they provide when the floods happening? How can they provide when they cannot do anything? So we have seen psychological men being affected, and also contributing to malnutrition, macro and micronutrient deficiencies, and also we have seen how pregnant women are being impacted, are being affected by climate change impacts. And these are also health issues, because I know we have just experts here, and they would understand the term pre-eclampsia and eclampsia, and also the wash aspect, access to water, and also the other aspects. So for now, I'll stop here. Thank you. Back to you.
Miss Malango, thank you so much. Very, very, very much inspirational. I totally agree with you that health is the human face of climate change. If we then treat it as a cross-cutting issue, I think we lose so many opportunities for us to be able to address the matter. So many health determining sectors are not taking into consideration the work which is supposed to be done at the intersection of climate change and health. You've raised a lot of views from the front line, from the most vulnerable populations, which really could give us a perspective in terms of what we should do in terms of addressing these issues. So we have heard about data gaps, climate change negotiations, how we bring man to the table, need for cross-sector collaboration, and views from the front line. Talking about cross-sector collaboration, let's now look into how countries are applying this in practice. And to do that, we are going to hear from Mr. Shitima from Zambia to tell us a bit more about the examples of cross-sectoral collaboration at the country level that have really delivered health and climate change wins, and also a bit of how can countries move from isolated projects, interventions, to systemic resilient health systems responding to climate change. Over to you, sir.
Thank you. Thank you very much, Dr. Mshosho, for that. And it's exciting to listen to colleagues elaborating on the health climate change intersection. From the Zambian perspective, I think the key point is what has been emphasized both by the keynote speaker, Dr. Muchangi, and others, the importance of coordination, intersectoral coordination. Fortunately, in Zambia, we've had this practice as far back as 2007, when we were preparing our National Adaptation Plan of Action, the NAPA, which preceded the NAPS. We have a technical committee on climate change, which has now even been enshrined in the Act as a coordinating structure when you are looking at climate change issues. And because of that, health has been at the center of that. It's not at the periphery. In the NAPA of 2007, we already identified health as one of the 5 key sectors that required attention. You'll be interested to know that by 2017, we actually prepared the sector NAP on health, the health NAP, which was even before we prepared the overall NAP, which was done in 2023, just 2 years ago. It is because of this cross-sectoral coordination and ensuring that health is part of that coordinating structure. And of course, then you identify the importance of health in the climate change context, that we had this health NAP developed as far as 2017. And as I said, we only prepared the overall NAP in 2023, but again, identified health as another important sector among the 9 that we have elaborated on. Now, in some of the interventions that have arisen from that is identifying what are the mitigation and adaptation actions that need to be taken in the health sector. And I'll just cite two because of time. Apart from application on the ground, but in the operations in health itself, for example, we've had efforts to phase out mercury thermometers, which are used by health practitioners, and use alternative digital thermometers in the health sector, particularly in our university teaching hospitals. And that is on the mitigation part because of the potential emissions that arise from the disposal of mercury thermometers. We've also had interventions in our incineration of how you address medical waste and how you dispose of that. Initially, most of our facilities, these were just bent, and of course you understand the emissions that arise from that. But we had incinerators that have been introduced in most of the health sectors, and that has reduced the emissions that are arising from that. So the key point is having a coordinating structure and ensuring that health is at the center of that and not treated on the periphery. Of course, we're still garnering evidence in terms of the impacts of climate change on health, but once you ensure that the coordinating structure has health among the sectors that are meeting, it becomes easier to demonstrate that and have the priorities enshrined in the national strategies. Now, in terms of how countries can move away from isolated projects, pilot projects, I think the new mantra that is coming up in terms of interventions, the platforms, country platforms, in terms of interventions that country embark on, is a platform that we should utilize, because this is looking at development projects that are at scale instead of isolated projects, sectoral and all that. What that means is at a country level, through the country platforms, you could have programs that are addressing both energy, water, agriculture, and other sectors, including health, under the platform. And you have a large-scale program that receives resources from various sources, and then you implement at scale. That would ensure that health is integrated within that platform and the priorities under health are implemented, and implementation will be at scale. Everyone wants to demonstrate results, and I think results are better demonstrated when you implement programs at scale with multi-billion programs, not just isolated a few millions of dollars, where it is difficult to demonstrate results. So I would submit that adopting the platform approach, the country platform approach, with the health integrated in those platforms, would help us to ensure that you implement at scale and health is not left behind in terms of the priorities. Thank you.
Thank you so much, sir, for the submission. This is quite serious leadership from Zambia right there, because if as back as 2007, things like this were already happening, I think it's a good thing to learn from. I think you've presented very interesting, practical steps which can actually be done on the ground to ensure that health is really elevated. I picked two things. Coordination systems are very critical. And secondly, what is coming through the platform for coordination, especially development projects at scale to deliver better results. I think that this is very critical in terms of ensuring that there is coordination among the health sector and also health determining sectors who would ordinarily, go on with their day-to-day business without thinking about health. So this is very, very, very critical. Colleagues, given that time has moved and we're left with a few minutes. Actually, we know that participants are itching to also ask a bit of questions, but also contribute. Just know that you are also free to post in the chat box. So if what we've had are the key messages, that are the key issues, how then do we translate this into what leaders in Addis will be asked to commit to? What we are discussing here, how do we ensure that we translate it to something which can reach the leaders during Addis meeting SES2? So this is critical. So thank you very much, our keynote speaker, our panelists, for such rich and insightful contributions. And at this point, I would like to open the floor to participants. This is your chance to share reflections, ask questions, or bring any experience from your own context that connect with today's theme. Feel free to post your questions in the chat box. My colleagues, David, Mr. Piri, can also help me to pick some questions which we may bring to the floor for discussions. And also our panelists may also respond to some of your questions in the chat box. It may be also contributions. You are free to do so. And I encourage you to keep your inputs brief and focused so that we can hear as many voices as possible. Unfortunately, according to my time here, we're left with 2 minutes, but I would like to work with David to see how we can actually manage the 2 minutes left. David, any restructuring of the approach?
Of course, we need to be flexible. So we will restructure the approach somewhat, and although we understand that there will be people who have to leave sharp on the hour, we do not want to miss out on discussing some of your very, very important questions. When I go to the chat, I have seen a lot of questions coming in, a total of 17 in total. And our expert colleague Friday Fury, our Amref lead on climate and health advocacy, has been addressing some of those answers. I've seen many questions coming past about participation of youth in climate and health discussions, in influencing policy, and people asking, how can we as youth be more influential in these spaces? And I wanted to ask Fury, maybe to allude to some of the answers he has provided, in case that is possible. Friday.
Yes, David. I can speak to some of the responses. I think I was fought mainly on two. The involvement, the participation of the young professionals, and I think from our perspective as Amref, we encourage participation of young people. We have a whole lot of work that is going on within the youth space. We have a very active youth projects within Amref, and I would encourage these young people to look out for some of these spaces. But secondly, just in their own countries, is to just ensure that they are making themselves useful and available to the authorities. There are many times that sometimes as young people, we just want to get involved when we see there is a monetary aspect of it. That's when we want to get involved. But I would encourage them to volunteer themselves when they are needed for some research components happening. And then it is from there that they'll be picked to take up larger roles for them to be actively involved in the space of climate, influencing climate and health policy. The other question, I think, which I also responded to in the chat, relates to how can the priorities of the local communities be the ones that are implemented when these projects, or when projects are put, or when projects are being implemented. Many a times that people have complained to say, we are implementing things that the community does not resonate. At Amref, we believe in a community-centered approach. And I think this is what we are also encouraging the governments that we work with the support, the technical support that we are giving, that for whatever project that we are going to implement, we always ensure that the grassroots have the voice. It is their voice, there's their needs that we take up to the donors and say, these are the needs of the local communities, and it is those local community needs that will support or will get supported for various projects. So it is this bottom-up approach that is required all the time. Otherwise, you cannot implement successful projects in the communities without their involvement. So that is the second component which I responded to. And I think somebody talked about the barriers that are affecting participation of young people in these spaces. I think in Africa we know that one of them is the literacy issues, the education levels, and of course the cultural elements themselves, especially like for the girl child. Sometimes they are limited in how far they can go. They can participate in public activities. And so these are some of the things that are already being addressed by different governments at different levels. But we are not at the same level in Africa. We know that we are at different levels. But we need to continue encouraging those governments that are already taking steps and those that are yet to ensure that these barriers are curtailed and allow young people more space in these spaces of development.
Thank you, Mr. Piri. Thank you so much. I wanted to quickly ask one of our panelists who spoke so passionately about youth. Malango, do you have some seconds to speak about youth involvement in policy negotiations, implementation, and other things? Malango, you are muted if you are speaking. Okay. Do we have other questions, David, or we can open the floor to say participants can actually raise their hands and come through to take the floor?
There
hello?
is there's Malango.
Yes, yes. Please go ahead.
Okay, thank you. So I think there was a question on how young people can participate. So I think some of the questions have been answered by Friday Pili, but I just want to add that young people can participate through different platforms that are already existing in the community, or also just following what's happening at the national level. So I would give an example how gender issues are coming out in every discussion because people are talking about it. But when it comes to health, not many people or not many young people are talking about it. Yes, they may be talking about it, maybe just focusing on the SRHR, for example, aspect. But health goes beyond to SRHR. So you can focus, you can find, I think the evidence that was being talked about, you can dive yourself into research and just find the gap that are existing in your community, for example. And then you can position that paper and present that paper as an issue. So it can be with at community level, at national level, and then it can be taken at international level. But what is needed is there should be like a voice coming from the young people. So I think this is how you can find yourself or participate in the climate change or in health nexus. Just find what is not working in your community and find the gap that is there in as far as climate change and health is concerned. Thank you.
Thank you. Thank you so much, Malango, for that. So can we get at least one question from the participants to take the floor and ask, or at least share any experience or any reflections from the floor? Participants? I see some hands. Can you help me to see? I see 3 hands. Okay. Shall we start with, okay, Monica, please take the floor.
Okay. Hope you're good.
Monica, you're very faint. Would you like to maybe get closer a bit to your mic?
Hello. Can you
I'm
hear
s-
me? Am I?
no, sorry, you are very faint. We are not able to hear you.
Oh, okay.
It's better now.
It's better.
Yes.
Okay. Um, is that- so, uh,
Monica, unfortunately, we are not able to hear you. We are going to kindly ask you to maybe put your contribution in the chat because we cannot hear you. I'm sorry.
okay.
Then we have, let's hear from Godfrey.
Yes, hello. Am I audible enough?
Yes, please say.
Thank you very much. My name is Godfrey Malongo. I'm an advocate for meaningful and inclusive youth participation from Malawi with Youth Wave. And I just wanted to add from the contributions that Malongo made. The speaker before her mentioned about young people that they should take up spaces. They should not just show up in monitoring processes. But I also wanted to say that I think learning from other avenues, I think we've seen decision makers and leaders who have made deliberate efforts to ensure that they are engaging young people. They keep the door open or just not wait for young people to come because we have all of these blocking barriers that affect meaningful and inclusive youth participation. And I think whether you should make quotas, whether you should create advisory positions, whether you should subgrad youth-led organizations, whether you should make specific engagement to say that if you're having a program or you're having an intervention to ensure that you have a minimum number of young people that you want to engage or number of youth-led organizations you want to engage, then those are the steps that have to be taken specifically by decision makers and our leaders, because this helps to remove all the other structural barriers that exist. Because I think now it's past time where we talk about the capacity of young people, because young people have proven to have the capacity to lead or to take part meaningfully in all of these interventions. So I think now it's the structural barriers that we have to deal with so that leaders should make deliberate efforts to ensure that they're engaging young people meaningfully. Thank you.
Okay. Thank you so much. Say thank you very much for that. Unfortunately, our time is actually not on our side, and we have to conclude. So please allow me to quickly reflect on the key messages, key advocacy messages, which our keynote speaker and our panelists have so kindly shared with us as something to actually take forward, and we can then close. So we have the first key message from Dr. Muchangi, which is very clear. We cannot continue being in the corner as the health sector. Integration is key. We need multi-sectoral collaboration. We need intersectoral data. We need to have people centered at our efforts. And lastly, we need authentic stories, such as the stories we've had in this meeting. From Dr. Sam Oti from IDRC, we need to capture policymakers. We must speak the language of money, bringing economists on board to generate economic analysis that can drive action and mobilize resources. Indeed, because we have to do some trade-offs. Thank you so much for that. And from Dr. Esel, for negotiations, climate and health require a unified African common position grounded in evidence, simplified in a way that a non-health sector person can understand clearly, and built through bottom-up collaboration across the sectors. This is very, very, very strong message. And from Mr. Shitima from Zambia, to move beyond siloed approaches, countries should adopt integrated country platforms, bringing together health, energy, water, agriculture, and other health determining sectors. This approach attracts resources, enables large-scale implementation, and ensures that health is not left behind. Um, so I think with this, we will stop with the key messages. And I just wanted to thank you so much. First, our keynote speaker, our panelists, and all our participants for such an engaging and thoughtful discussion. Today, we've heard how evidence, lived experiences, financing strategies, and national approaches all converge to show that health is not just a sectoral concern, but a strategic climate investment for Africa. So as we head to ACS2, the messages from this dialogue feed directly into the high-level outcomes of the summit. From the Addis Ababa Declaration to the mobilization of investments and a clear roadmap of implementation, the insights we've gathered here today will really help us to strengthen the collective advocacy needed to ensure that health is fully recognized, resourced, and acted upon in Africa's climate agenda. This is not the end of the conversation, but the beginning of stronger collaboration. So let us carry forward this momentum into Addis and beyond, working together to ensure health is firmly at the center of Africa's climate resilience. Thank you once again for your contributions, and we look forward to continuing this journey together at ACS2 and beyond. David, you are the main organizer. Anything I've left, let me hand over this meeting to you.
Thank you, Dr. Mushosho. There's nothing that has been left, as so many important issues have been addressed by yourself, Dr. Mushangi, and our 4 panelists. So with this, lets me to thank all of you for attending, and very, very much looking forward to see some of you at the Africa Climate Summit too. And please take these messages with you. Not only ACS2 will benefit from them, but wider as well. We will be communicating them across our Amref channels as well. So keep an eye out for that. Subscribe to the channels or the newsletters so you'll be able to receive them. And what we will also do is send you a list of the convenings that are happening at ACS2, so you will be up to date on that. Thanks again, Dr. Mushosho, for the smooth facilitation of this webinar, and very much looking forward to see you in Addis. Wishing all of you a great rest of the day. Thanks and bye.
Thank you, colleagues. Bye-bye. Thank you so much.